Hello, guys. We are going to talk about exocrine pancreatic disorders. Pancreatic disorders are subdivided into endocrine pancreatic disorders and exocrine pancreatic disorders. The endocrine pancreatic disorders is the main cause of diabetes mellitus. We are going to look at exocrine pancreatic disorders. Exocrine pancreatic disorders. We will look at pancreatitis. Pancreatitis is the inflammation of the pancreas. This inflammation can be acute and chronic. Acute pancreatitis usually develops in a middle life. Gallstone and alcoholism are the primary risk factors for acute pancreatitis. Alcoholism is the primary risk factors for chronic pancreatitis. Gallstone and alcoholism are the primary risk factors for acute pancreatitis. Alcoholism is the primary risk factors for chronic pancreatitis. Acute pancreatitis is a pathophysiology. This occurs when the pancreas is damaged and the duct to the duodenum is blocked, allowing pancreatic enzyme to accumulate within the pancreas. Pancreatic duct obstruction by a gallstone or spasm of the sphincter of Oddi can obstruct the outflow of pancreatic enzyme. When this happens, a self-destructive process known as autodigestion begins. There is signs and symptoms. This autodigestion now results to necrotizing action of the pancreas, leading to inflammation. The signs and symptoms. We have acute epigastric pain, which may radiate to the back, nausea and vomiting, abdominal distension, decreased bowel sound, low-grade fever, tachycardia, hypotension, cold clammy skin, elevated white blood cells, serum amylase and lipase. The elevated serum white blood cells as a result of the inflammation. Disturbance in metabolism may lead to diabetes mellitus. The chronic pancreatitis gradually destroy the pancreas following acute pancreatitis. The causes of the chronic pancreatitis are alcoholism, primary risk factors, malnutrition, secondary risk factors, pancreatic stone, a calcified or stone-like protein which block the pancreas, complications, malabsorption, malnutrition, peptic ulcer disease, pancreatic cancer, necrotic addiction due to frequent episodes. The medical management. We have assessment. History taking. Under assessment, take the history of patient for alcoholism. History of the patient for the management of disease like gallstone. History of medication or surgery. History of obstructed gallbladder or history of blocked duodenum. Take vital signs of the patient for elevated temperature. Vital signs, especially temperature, for elevated temperature. The medication, you give the patient pain relief drugs, example petidine, pentatoxin, antibiotic drugs like metronidazole, ampiclox, vitamin K to stop the bleeding. Surgery is usually done in the hospital by the doctor for the removal of the calculi in the pancreatic duct. Exploratory laparotomy to detect the causes of pain. Nursing management. Assess the vital signs. Patient's vital signs. The general response and appearance of the patients are monitored. Monitor the location and intensity of pain. Monitor fluid intake and output. Observe the sclerae and skin for jaundice. Gastric drainage. Pass nasogastric tube for regular aspiration of drains to reduce abdominal distension. Observe the nature of the drains for bleeding. Restrict or reduce oral nasogastric or nasogastric intake and continue with intravenous fluid. Fluid and electrolyte. Administer normal saline, dextrose saline. Plasma or whole blood may be given. Monitor input and output charge. Weigh the patient daily. The diet, when oral intake resumes, intravenous fluid is given in small quantity. The food should be high in carbohydrate, moderate protein, and low or no fat. The diet should be served in small amounts. Advise patients to avoid taking large meals. Monitor mouth and nasal care. Mouth and nasal care. Regular oral care. Administer petroleum jelly on the lips to prevent crack. Pulmonary care. Nurse patient in semi-upright position to reduce pressure on the diaphragm. Psychological support. Establish a rapport with the patient. Communicate and reassure the patient on the management plan. Discharge and follow-up. Inform patient about the date for the discharge and also for the follow-up of the patient. Thank you for viewing and listening. Always like, subscribe, follow my page and make comment. You may ask any question. I will respond to your question in the next video.